One of our very favorite booths when we are in Central Park is Ask the Healthcare Expert booth. First of all, we have Dr. Ritesh Ramdhani, who is the director of the Deep Brain Stimulation Program and associate director of the Parkinson's Disease and Movement Disorder Center at Northwell Health. Dr. Ramdhani, our first question comes from Brian today, and it's absolutely one of my favorites and one I get on the road all the time. How is a movement disorder specialist different from a neurologist in the case of a Parkinson's patient?
Carol, that's a great question. Movement disorder specialist has additional training in diagnosing and treating patients with Parkinson's disease and other movement disorders. And so they're really subspecialists that focus on confirming that a patient does indeed have Parkinson's, and then really works with the patient and possibly even their general neurologist in tailoring a treatment plan appropriate for them at their given stage of Parkinson's. These individuals also are quite involved with research, many of them, and so can refer patients to a number of clinical trials, as well as be a platform for understanding and conceptualizing new research studies that have come out in the field as well.
It's so important. I wish I could video some of the calls I get, and when those people go from a primary care to a general neurologist, and then they see someone like you, I get all these calls that say, wow, I have a life now. I know I have hope. There's a lot of things I can do. There are a lot of therapies. It just changes their whole life sometimes. So very, very important. Dr. Ramdhani, our second question comes from Susan. My dad was the oldest of 3 boys. He was diagnosed with Parkinson's first. His youngest brother was then diagnosed, and his middle brother had a fall and was diagnosed with Parkinson's disease. Is this just a coincidence, or is this genetic?
There's about 3 to 5% of all Parkinson's patients have a associated genetic cause that can run in families, but sometimes skips generations. Given that particular history of several first-degree relatives having being diagnosed with Parkinson's, it does raise a suspicion of the possibility of an associated Parkinson's gene, sort of being the primary cause of the Parkinson's. But let's keep in mind that, again, it's a very small percentage of patients that have an actual Parkinson's gene. There's many other risk factors, including genetics and environmental risk factors, that play into this diagnosis. And so it's always important to sort of place everything in its right context. But certainly we know that genes play a significant role in the onset of the disease, as well as in aspects of how it progresses.
I think that's always the first question they think of when they have a very close relative like that. Dr. Ramdhani, our third question comes from Janice. My toes are numb and twisting to the left on my right foot, and my left foot twists so much I'm practically walking on my ankle. Is there any treatment to correct this?
That's a challenging question, especially without seeing what that twisting looks like. And one of the things about a movement specialist, it's being able to visualize an individual and visualize those symptoms. It's so important in order to better understand what the symptom is, and is it on the spectrum of what we would expect with someone having Parkinson's. When you hear a term like twisting or bending in a particular limb, it raises the possibility of whether an individual may have a movement disorder called dystonia, which is involuntary activation of certain muscle groups in the limb that can cause the toes or the foot to assume abnormal postures. And now you could see that in Parkinson's as well, especially in the foot. It's not an uncommon diagnosis. And there's medications as well, treatments for that, including anticholinergic treatments, muscle relaxants, even levodopa can be used to treat it. And the non-pharmacological approaches that have become that have been shown to be very efficacious in managing a dystonia, particularly of the foot, is botulinum toxin injections. These are focused injections, intramuscular injections, done by a movement specialist as well in the office, that can sort of relax the activation, and it's repeated on a regular basis. But the most important thing is really visualizing those symptoms and determining if it is in fact an associated movement disorder like dystonia, which you can see in the context of in Parkinson's.
Excellent. Dr. Ramdhani, is this something, since we're kind of still in the middle of this pandemic, is this something that if Janice called you and you did a telehealth visit, would you be able to make some kind of decision by that?
Certainly, I think that we've seen an exponential expansion in telehealth due to the pandemic, and one of the beauties about this field is that we could tell a lot by looking at an individual move within their native surroundings, and so it's possible that we would be able to get a better understanding of the symptoms that she is dealing with through a virtual appointment.
Wow. So not every visit needs to be a telehealth visit, but to get someone like that and start them off on the right foot is amazing. Just really amazing. Our fourth question is from Joe, Dr. Ramdhani, and his question: how important are lithium levels when treating Parkinson's disease?
Well, there's really no role for monitoring serum lithium levels in Parkinson's patients. The only time lithium level is really checked is in the setting of psychiatric management for bipolar disorder, where psychiatrists may want to monitor the levels. But for Parkinson's disease, no associated utility in monitoring lithium levels unless a patient has been on lithium for many years and there is a suspicion that lithium may be causing a drug-induced Parkinsonism. In that context, it may be worthwhile to at least check the level, not necessarily monitor it, but to check it and to help assist in the diagnosis of drug-induced Parkinsonism.
Excellent. Thank you very much, Dr. Ramdhani.
Thank you, Carol. Always a pleasure.